Hello, happy Sunday. Welcome to all my viewers. I just want to use this time to welcome you to Table Talk with Rita Fele Hara. Today, I just want to use this time to thank you guys for all the ones that have been logging in and making sure that they follow us. I just want to thank you for doing that. Today, we are going to be this is Table Talk with Rita Felehara. Like I said, once again, if you want to be part of this conversation, please share this please share this video, be part of it. The link will be down there on PROIB blog, and the link will be as well on Bantu blog and Daughters of Sierra Leone in my personal platform, Rita Fele Haram. So today we're going to be talking about cancer. I know it's a broad topic, but we're gonna try to do the best that we can. So we have few people that we're waiting for to join us. So while we're waiting, if you want to be part of this conversation, you can join on PROIB blog, and you can join on Bantu blog, and you can join on Daughters of Sierra Leone platform, and you can join as well on my personal platform, Rita Fele Hara. Happy Sunday. And I just want to thank you guys for being part of this. While we're waiting on our guests, we're going to start about cancer. So you can be part of the conversation. The link will be there. You can just click on the link and you can be right on and being part of this conversation. Cancer. I know a lot of cancer has been going on in our community, but some people don't want to talk about it. They felt like, okay, if I talk about it, we always have this thing. I don't want these people to know. I don't want this person to hear. But it's good to share what you're going through. That way, you can be able to have solution, if I should say. You can able to have someone that could able to call and check and see how you're doing. It's okay for someone to know. So all the secrecy, as Africans, we don't want to tell anybody. We don't want this person to hear us. We don't want anyone to know what we are going through. So that's the problem. So I just want to say that whatever you are going through, just learn to share with other people. Just learn to share with other people so people can be able to help you. Probably someone can say, oh, this is what I was going through, or this is how I feel, or this is what was going on with me, and that was how I was able to solve the situation. So please feel free to share, and if you want to be part of this conversation, you can join from PROIB blog, and you can join as well on Bantu blog and on Daughters of Sierra Leone platform and Rita Fele Hara. So while we're still waiting on our guest, so we're still waiting on people to join us. So please bear with us. You know, different people are connecting from different places. So please just bear with us, please. Thank you. And once again, I just want to welcome you guys and I want to say happy Sunday. I am happy, I am grateful to be alive and to be here with you guys. And for all of you that are using your data to be part of this. So I just want to thank you guys because I know it's not easy in Africa to buy wherever you are watching us from, to buy your credits, or you're using your data, your time. Time is very, very important, but you are using that as well to connect and to listen to what we have to say. So I just want to thank you guys for that, because there's no way we'll be able to do this without you guys. There's no way. So I'm going to give a few more minutes. Let's wait for our other panelists to join us. Hello, Dr. Daniel. Can you hear me?
Yes, I can hear you now. Can you hear me?
Okay, thank you. Yes. Welcome, Dr. Daniel, and thank you for being here. Dr. Daniel, we are already live,
Can you
so
hear
I
me?
would love for you to. Yes, I can hear you. Yes, I can. Can you hear me?
Yes, I can hear you. Can you hear me?
Yes. So you can go ahead and introduce yourself, sir, Dr. Daniel.
Okay. Good evening, everybody. It's evening here in Nigeria. It's 8:06 p.m. I am Dr. Daniel Adepobi Adejobi. I am a neuro physiotherapist, and I'm a Nigerian by citizenship, and I live and reside in Nigeria presently. I work as a neurophysiotherapist with the Premier University College Hospital in Ibadan in Nigeria. Involved in neurocritical care, which also involve taking care of oncology patients, basically patients with cancer who might spread to the brain or affect their neural function. So basically, so I'm Daniel Adepoju Adejobi, and I'm glad to be here. Thank you very much.
Thank you, Dr. Daniel. I just want to welcome you guys again, once again. If you're joining us just now, you're watching Table Talk with Rita Fele Hara. And today here we have with us a great, we have Dr. Daniel that is joining us from Nigeria. We have other panelists that will be joining us as well. So please bear with us when they get here. They can introduce themselves as well. So I just want to use this opportunity to thank you for tuning in today, and happy Sunday. If you want to be part of this conversation, you can join from PROIB blog. You can join on Bontu blog and Daughters of Sierra Leone platform, and you can join as well on Rita Fele Hara. Thank you, Dr. Daniel. We're talking about cancer, and like I know cancer, when people get to hear cancer, and we all have that fear in us, like, oh, cancer, what is cancer, and how to manage it, and what are the signs, and how to deal with it. So I would love for you to go into it a little bit more on that, if you can, sir. Dr. Daniel. Okay, sorry. Now we can hear you, Dr. Daniel. We can hear you. Okay, we can hear. All right, welcome again. Happy Sunday, Dr. Daniel. For some reason, we cannot hear you. Probably, if you can hear me, can you raise your hands so I can see you? Okay, welcome to Table Talk with Rita Fele Hara, CEO and founders of Daughters of Sierra Leone. Today we're going to be discussing about cancer. So I would love to introduce Nancy Kamara. Can you please introduce yourself if you're here?
Simi, I'm also a nurse, work in a acute setting in Columbus, Ohio, and I've known Rita for quite some time. She's my older sister, so thank you for having me to your talk show.
Thank you, Nancy. Thank you. By the way, you look beautiful, and thank you for having you here today. You know how this thing goes. We have different people connecting from Africa and everywhere, so it's kind of hard sometimes. Dr. Daniel, can you hear me?
kind of hard sometimes. Dr. Daniel, can you?
Okay, for all speakers, if we are not speaking, for us to mute our phones or device, because I'm kind of getting like signals from, I don't know where I'm getting the signal from, but we are getting a bad signal. So if we're not speaking, for us to mute our phone. So let me go back and do introduction and then we can come back. So for those of you that are joining us today, happy Sunday, and I want to welcome you to Table Talk with Rita Felehara, the CEO and founders of Daughters of Sierra Leone. If you're watching from PROIB blog, you're watching as well on Bantu blog, and you are watching from Daughters of Sierra Leone platform and my personal platform, Rita Felehara. So I have here with me Nansimi Kamara, and I have Dr. Daniel that is joining us from Nigeria. And while we are waiting for other panelists, if you can hear me, Dr. Daniel, can you raise your hands? Okay, I'm gonna go to our other speaker, Nancy Kamara. Nancy, I know a lot of times in our communities and our society as an whole, people, we don't like to talk about cancer. When we heard about cancer, a lot of people be like, cancer, oh, I'm going to die tomorrow. So as a nurse, you've been a nurse for over 17 years or 18 years. So what do you think about that?
Thank you for having me once more. First and foremost, when we're talking about cancer, we have to think about the fear of death because that's what everybody see cancer as is that fear. And once you hear the word cancer, the next thing you're gonna think is death, 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 death. And it's the most scary part about cancer. And I think that's the fear itself of cancer is the one that puts so much pressure on not only the patient but the family as a whole. So cancer is something I would say it's the name itself is scary.
It's scary, yeah. I definitely agree with you because the fact that you just got diagnosed and get to know that, oh, they say cancer, is just, it sounds fearful. And you be like, am I going to die? The first thing that comes to your mind, am I dying? I know a lot of people feel like, okay, when they say they diagnose you with cancer, you are going to die. So how can we, because we talk about how to manage it, right? And how to deal with it and talk to our family members that, okay, this is what I am going through. So you need that support system. As a nurse, do you think that is important for people to let their loved one know that this is what I'm going through? And what part can our loved ones play in situations like this?
As a nurse, personally, I will say when it comes to cancer, early detection is very, very important. Early detection. When you get detected early, there's a possibility of radiation, chemotherapy, and maybe if it's breast, they always say we're going to have a mastectomy, which is removal of the breast tissue wherever it's affected. But most people usually get a complete mastectomy, where they remove wherever area is affected. If it's the right breast, they usually go for take it out. If the left one, they usually take both out. Emotional support is a key factor. Emotional support for the family and the patient. And that's where the interdisciplinary team, when it comes to the doctor, therapist, everybody involved in the team of providing care for this particular individual comes in play. That's when they start providing support for the family, not only the patient, but also the family. Because you have to understand once a patient being diagnosed, not only the patient is your patient anymore, the family, as everybody in the family becomes, that is involved in care, become your patient at that particular moment. Yeah. Can you hear me?
Yes, thank you so much, Nancy. Because I notice cancer has become very common, like a malaria, in our African communities, and most of the time, um, I believe that we are not going to do regular checkups. So if we have a backache or any symptoms, we don't know because we felt like if we don't go to the hospital, a doctor cannot diagnose me for, I don't want to know what's going on. So as a nurse, do you think it's okay if I'm feeling a certain way, or if it's okay to for a woman to do a mammogram every year, or to go to your doctor in a certain age to check for colon cancer and to check for other different types of cancer, because I know we have different type of cancer. So you think it's okay? Do we encourage our people to be checking more regularly, so that way we know what's going on in our system, in our body, so that way we can prevent it not to go so far? By the time you go, you are in stage 4. So is it better to early diagnose? Is better for you to know that, not knowing, you went last minute, they say you have cancer, he has getting up to here. So as a nurse, do you think that it's you advise people to go and check regularly, or do you think that it's okay, just stay home and drink Panadol or Tylenol or aspirin or whatever, the pains will go away?
Okay. For in our community, especially Africans, I don't know if it's a stigma, but we have this issue where we are always afraid to go get checked and get a regular physical. And that's the big issue in our community. Most time you find out when someone in our community get diagnosed, you find out they are already on stage 4 or stage 3. That's because we don't get checked out. And it's very important for a female, I must say, and cancer is not only among female, it's also among male. But you will find out among the female, whenever we do have get checked out and they say, okay, you have cancer, we already have stage 4. The sad part about it is that we did not go get checked. Maybe if you had went and get checked with your regular mammogram or your regular pap smear, just your regular physical, you probably already get detected and start treatment immediately. Early treatment is the key. If you don't get checked out and you do not know, you are not going to get the treatment and the support you need on time. Because with cancer, the earlier, the better. The later on, you didn't go get checked, that's where the problem, like really, really, that's where we'll get to that stage where I was like, okay, life and death situation. But it doesn't mean because you're diagnosed with cancer, you're going to die. But if you do get checked out, there's a possibility with treatment, proper treatment. And that's, like I say, in our community, I think it's the stigma that a lot of people are afraid of, and the fear of the unknown is also a big part to where a lot of people said, oh, I don't want to go get checked out because I don't want to know. I don't want to know. And I don't want to know, not supposed to be when it comes to your health. Get checked out. Even as a female, if you're taking a shower, you can, with warm water, you can check yourself. You can check your breast. Thank you.
Thank you, Nancy May Kamara. I just want to welcome you guys again. Once again, this is Table Talk with Rita Felehara. If you're joining us, happy Sunday. And we are happy to have you here. Dr. Daniel, are you there? If we have other panelists, can they please introduce themselves? Okay, we are going to go right on back to the program. This is Table Talk with Rita Felehara, CEO and founders of Daughters of Sierra Leone. If you're watching us, you're watching from PROIB blog and from Bantu blog and from Rita Felehara and Daughters of Sierra Leone platform. Nancy, we talked about the stigma. We talked about how when we go to hospital as Africans, and pretty much you will see a white or black American will tell you, I have cancer, you know, and but I'm taking treatment, and they are not ashamed about it. It's not something to be ashamed of. If you have something, it's good for you to let people know, this is what I'm going through. And a lot of times we don't do all those things that you just mentioned about doing regularly. If you ask a female now, when was the last time you do your pap smear? We don't know. What was the last time you do your mammogram? We don't know. What was the last time you went to your actual doctor to actually check what's going on? You know, like they normally say that the body is not a firewood, meaning the body is not a wood. You know, you should go and get checked every year. I encourage for people to go check your doctor and see what's going on in your system, because we've lose so many people without knowing that they have this cancer, or they are going through this, because we just all of a sudden his back was hurting him, all of a sudden he's dead. um this was happening before you look, he's dead. So a lot of people that are cancer survivor, Nancy, I believe you can attest to that. There's so many people that have been diagnosed with cancer, but because it's early detected, they detect it early, they were able to be on medication. They were able to make sure that they stay on top of it. Because when you knew what's going on in your system, you are able to control it. The doctors are able to go right on it and make sure that you are okay. I have known so many people that are survival of cancer, and I know the breast cancer, it's a lot out there that is affecting a lot of women. Nancy, do you have
Well,
anything to talk
well,
about that?
okay. So the thing is, most of the time you hear somebody say, "I have breast cancer," but at least with breast cancer, it's early detected. But you have to think about cervical cancer. A yearly pap smear. Once they go in and scrape, they can be able to detect that if there is an abnormal growth, abnormal cells. They're able to say, okay, we have to proceed and do some more. We have to take some sample. We have to get test. We have to get you tested.
Mm-hmm.
Because with cervical cancer, it's even more, so much out there, and people don't even know about it, because that's one of the cancer that is very hard to detect, because you do not know. If you don't go get pap smear done, you do not know. Sometimes you just have this regular pain, and you just think, okay, it's just a regular pain, it will go away. No, please don't say it's a regular pain. Go get checked. Go out and see your doctor. Get your regular check. Get your yearly pap smear. Once you get your yearly pap smear, there is sometimes with abnormal cells or abnormal growth in your area, where the doctor gonna say, okay, we don't need you to come every year anymore. I want you to come every 6 months. That's a preventive measures. Those are things that doctors put in place, but it's up to you as an individual to go and get checked. As breast cancer is out there, it's a lot, but with you checking your breast in a circular motion when you're taking a shower, that's a simple way of checking to see, hey, do I feel any lump? Did I feel something different? And if you do feel something different, which is regular, when you're taking a shower, you can call your doctor. Lift your hand up, like put your hands around your head like this, and go around in circular motion while you check. And if you feel anything abnormal, call your doctor, call your provider, go get checked out. Don't wait, because the earlier the better.
Thank you, Nazimi Kamara. For those of you that are joining us, this is Table Talk with Rita Felihara. You are watching from PROIB blog, and you are watching as well on Bantu blog and Daughters of Sierra Leone platform, and my personal platform, Rita Felihara. JD, thank you, JD Bangura. I want to thank you. And for Kabakante, I want to thank you as well for your comment. If you want to be part of this conversation, you can see the link on PROIB blog and Bantu blog on my partner platform, Rita Fele Hara. Thank you, Lady Vera Okumbajo. Thank you so much. While we are waiting for other guests to join us, so Nancy, Miss Nancy Kamara. Um, so first of all, um, like you said, it's very important for our folks that are living in Africa, that they don't know what pap smear is. I believe we have marriage stops, we have a lot of women clinic, and you can go there. I know Maristop is very, very affordable. You can go there and go get checked. If you're in Nigeria, they have a lot of women clinic. Dr. Daniel, I'm sorry we're having a hard time having you back. That's you can actually go and get checked. Don't be scared. Don't be scared. Dr. Daniel, are you here? Can you hear me? We are having a hard time having Dr. Daniel. This internet, the devil is a liar. Well, thank you, thank you, thank you. So I just wanted to add to what Nancy was just saying, that it's good to go get checked. It's good. It's nothing wrong for you to go get checked. You get to know that this is what I am going through. It's just the same thing when you go to the hospital or you go to a pharmacist. This is not a pharmacy issue now. This is an actual doctor. You go and get diagnosed and know that this is what is wrong with my system. So, Dr. Daniel, if you can hear me, sir, can you go ahead? Nancy, can you hear him?
No, I don't. I can't hear.
I can hear. Yeah. Okay. Um, Sorry, guys, and I just want you guys to be patient with us. And so while we're trying to get Dr. Daniel, we're having a lot of trouble having him here. And I'm sorry, I'm sorry. Nancy, so do you have anything to say? Let's go right on.
Well, when it comes to check out check I'm pretty sure in Sierra Leone they have places that you can go to. Like I'm pretty sure they have Aberdeen Women's Center, they have Mary Stope, they have Connaught Hospital, they have even government hospital. I think they have different facilities and also private facilities in Sierra Leone that people can do go and get checked. Can you hear me?
Yes, I can hear you, Nancy.
Yes. Like I was saying, in Sierra Leone, we do have different facilities, either a government facility. I'm pretty sure Mary Stope has been there for ages. They have the Aberdeen Women Clinic that has been there as well for ages. They
Right.
do have private sectors, which is private providers in
Practice.
Sierra Leone. They have Connaught. They have different facilities that people can go and get checked. Not only that, you also can do a self exam at home by yourself while you're taking a bath. You can also do that. Those are things that are very important, especially when it comes to breast cancer. For the male, on the other hand, I understand um, with male, a lot of colon cancer is very, very high in male, especially African American or African in general. There is a lot of colon cancer, and that's because for a male to get their colon cleansed and checked, it's not every man that like a needle to be inserted in their penis area or in their rectum area as well to go and get that colon to go get clipped. Not all men like to get that exam done. It's very uncomfortable for a lot of men. So a lot of men do not get checked, and it's very aggressive. By the time you get checked, it's already spread. It's already probably like stage 4. It's very, very paramount in men for them to get checked, but you don't hear a topic or a conversation with men, especially in Africa, to say, oh yes, I go get checked or I go get my colon cleansed and stuff like that. You don't hear that at all.
True, Nancy. I definitely agree with you. And our men don't go and get checked. And so we are encouraging our men to go get checked. It's not because you're not feeling anything. So you feel like everything is okay down there. You feel like you're very healthy. We are not calling any sickness on anyone, but it's advisable to go and get yourself checked. Thank you, Lady V. That's a very great point that you've just mentioned. And a lot of times we don't go get checked. Our men don't go get checked. Nobody wants to get checked. I know sometimes it's very hard, very, very hard for us to hear bad news. But a situation like this, it is what it is. You have to deal with it. You have this. It's better for you you detect it early and you start treating that. So in our communities, we've lost so many people, so many people with cancer. Some people will say, "Oh, somebody sent me a witch gun." I believe, Miss Camara, you've heard about that. Oh, somebody sent me a witch gun, so that is what's happening with me. So I need to go back home and drink some agbo. Nigerians call it. If you're watching, you say that I'm drinking agbo, or I'm going to go do some concussion, or I'm going to go spiritual ways. I'm not saying our spiritual apps are not very effective, but if you have cancer and you're drinking a lot of agbo, or you're drinking a lot of bangba, we call it bangba, all these native roots, you're drinking a lot of it, it's not going to help the solution. And like I remember growing up as a child, when I drink bangba, if I'm in my mess, like it's my mess, if I'm on my period, it flows for me heavily, right? But then I know that because when you take those medications, they don't have a measurement, they don't have a dosage, right? You just drink, right? So you don't know the amounts that you're drinking, or why are you bleeding so much. So but because of it's what we are raised with, we just drink all of it. Some man will drink 5 cup of bangba, or drink agbo 5 cup, and then you think that the solution is going to be cured. No, it's not that way. So now when you go and get diagnosed, you know what's going on with your body. If it's a medication, they put you on a medication. Let's say if your eye and is paining you, they give you a medication for that. You're taking that medication. So please, let be very aware and be very sensitive to our health. Very, very sensitive. Is very, very important. We are losing so many great women and men in society because of simple thing. Just go and get yourself checked. So I'll be back with you, Miss Kamara.
Definitely.
Okay, so what do you advise for our males, females out there, for them to do, and how often can they go and get checked?
Um, for um, for a female, usually they would say get a mammogram yearly, get a pap smear yearly. But I'm pretty sure with age after 40, I'm pretty sure it's every 6 months, if I'm not mistaken. You have to get a checkup. With pap smear, I believe is still yearly. If there is no abnormal findings where you're required by your provider to come in and get checked. And those are things that are very important. And with the male, I do understand it's very, for us here in America, we can say we are grateful, we are thankful because we have the opportunity. There is equipment being used that is here for us to be used. Whereas in Africa, we do not have all those facility, especially in my country. I'm not saying in Nigeria because I can say they're a little bit more advanced than my country, Sierra Leone. However, if there is a place that do, it might not be much, but even if they have one place that do provide these services, I will advise that for the men in general, in particular, to do get checked out. Just don't say, oh, soon as you start getting sick, oh, somebody do me witch gun, or somebody do me something. Go get checked out. Please do go get checked out. Cancer is real. It's real. and it's one of the things that is very difficult to treat. It's very, very difficult to treat. And if they do not cut it in an early stage, by the time you get diagnosed, it's too late. So please don't take chances for the female, young ladies, female, and especially we are looking at, I think it was it's a study where even children in America do start getting the HPV vaccine, which is for like my daughter, she is 12, and last month, before she even started, because they advised
For you to
before you,
take it.
yes, before you start your menstrual cycle or before you get into any sexual activity, for you to take
You
your
to take
HPV
it.
vaccine, which it's a two series, it's a two dose. They will give you one dose now, and within 6 months you have to get the second dose, and that usually the doctors say it helps prevent cervical cancer, because it's something that is out there and it's very, very severe. It's worse, it's painful, because I've dealt with patients that I take care of. I mean, I've took care of so many of them, and I know what they go through, and that's the painful thing. That's the most painful part, to see a family member or someone that you love, yet alone. As a nurse, being a nurse, you have to show that empathy. You have to switch position, and once you become attached to this patient, it's one of the most difficult things to see your patient, someone that you love so dearly, go through so much pain. Just, some of them do get checked, some of them do get checked out, but you also have to think about cancer as, okay, a family, do your mother have breast cancer? Do you know if your grandma, your great grandma have cancer before? Do you, if your auntie had cancer? From your mother's side or your father's side, or any of your family member, you have to think about something that you inherit as well, not only female but as well as male. So you got to think about all these things that surrounding cancer. It's just not what you, not the what you put, the pollution. It's not the chemical. It's not that you have to think about something that it was my grandfather that had it before. It might skip one or two
Generation.
but it might, somebody in your family, if your great father have it, somebody definitely in your family is you're gonna inherit that. So it's up to you as an individual to get
To
checked
control
out.
it.
That's the most important thing, is to get checked out. Without you not getting checked out, without you not knowing, then there is no way to treat. And treatment in an early stage is more vital than anything you can imagine when it comes to cancer.
Hmm.
You know?
Thank you, Nancy.
Mm-hmm.
Thank you, Nancy. Lady Vera Okumbajo is saying, correct again, Nancy. In Nigeria as well, most people cannot afford regular checkups. Thank you, Lady Vera Okumbajo, for that comment. And if you are joining us again, we would like to welcome you for watching Table Talk with Rita Afele Harasi and founders of Daughters of Sierra Leone. If you're watching from PROIB blog, and you're watching as well on Bontu blog and Daughters of Sierra Leone platform and my personal platform, Rita Fele Hara. We are having a hard time having Dr. Daniel here with us, joining from Nigeria. You all know how it is in Africa. He's been trying so hard. Dr. Daniel, thank you so much for trying and for being here. He has been here with me backstage for a while. So I just want to thank him for making his time and his Sunday, taking him from his family to be here with us, Dr. Daniel. I just want to appreciate you. And for Lady V, I just want to thank you, JD. I want to thank you guys all for being here with us today. And Samuel Omotosho, while we are still waiting. Samuel, are you here? Samuel? Samuel? Hi, Samuel. Okay, we're having a hard time having. I think it's a bad connection in Nigeria today, but the
Uh,
devil is a liar.
Independence. So I think it's the independence. Is it today, yesterday, or something there?
Yeah, it was yesterday. Happy Independence to Niger.
Yeah.
I pray that this independence that you guys just celebrate, God will bring peace. He will bring a lot of wisdom to our leaders out there. And I just want to celebrate with you guys. It's not been easy, and I know a lot of people out there are going through a lot. But let's just be patient, and very soon change will be there, and we will all be happy, and cost of living will go back to how it used to be. So happy Independent Day to all Nigerians. And I'm a Nigerian by marriage, by the way. Happy independence to me as well. Nancy, let's go right on to the program. um, like we normally say that it's good to get checked. Like for me personally, let me share. I've had so many people around me. I have an uncle that has a breast cancer, and it's a breast cancer survival, and I just want to thank God for him. And I've had my cousin that have had cancer, breast cancer, both breast, and she survived it as well because she detected very early, and she was able to survive it. And I've known so many people that we have lost because of um, they didn't detect it early. When they get to the hospital, it was already stage 4. So there's no way that it could do it. It could only be God, and God could just intervene and say, you know what, this is it. But sometimes we call on God, and sometimes when we call on him, it's too late. So let's just be realistic. Let's just know that, okay, it's just like, okay, if you're going to the store, you didn't take no money to the store, and you want to go buy groceries, the grocery is not just going to come and just, it takes a miracle, right? So you keep praying and you keep asking God for God to intervene. And so please, for us to go get checked, for us to be very conscious, for us to be very, very sensitive with our health. It's very, very important. So, Miss Nancy McNamara, I'll leave it up to you if you have anything else to add to what we just discussed, and then you can go right on.
Yeah, I also want to say please get checked out because cancer is real. It's one of the most dangerous diseases out there, and people just don't understand, especially um in the part of our world where it's in Africa. We are so quick to just we used to in Sierra Leone we say pepper doctor we serve. We quick for go pepper doctor we serve instead of go get checked out. If you aid at you go say, oh, me aid that me la go buy ma go pepper doctor me serve. Or if you they cough, ma go bala go buy, let them go give me a antibiotic IV or something like that. That's what I've seen recently a lot. Please do not self-medicate yourself. Go get checked out because you might be treating yourself, but you're not treating yourself for what you actually have. So please go get checked out. You also have to think about it. There's a lot of cancer. So some people just don't understand. They only think it's breast cancer. No, it's not just breast cancer. So mostly, especially in our world where people smoke a lot, you have lung cancer, which is very, very, very popular as well in Africa. But because of we are not being diagnosed, we are not being checked. You will not know. You don't go get X-ray, you don't go get chest X-ray, you don't go get nothing done. You cannot actually be diagnosed with those type of diseases, and you will not know. So no pepper, don't pepper doctor yourself. In Sierra Leone, we say no pepper doctor yourself. Go get checked out. It's more important. And also, if you're in Nigeria or any part of the world that you find yourself, if you're watching this program, please see your provider. Go. They have free clinics in most places. It might not be the best, but at least you do get checked out by someone. Please go get checked out. That's very, very vital. That's very important to your health. I will advise every single lady out there, if you cannot afford um, the hospital fee, or if you cannot, do a self exam when you're taking a shower. Do a self exam in the bathroom. Lift your hand. If you're checking your right or your left, put your hand around like this. tilt and go in a circular motion like this. Go around your breast, feel around, and go around and check. That's one way. That's the most simplest, that's the most free way you can help yourself, is by doing that. Go to Maristop, go to any free clinic around in Africa that you know they do check, and get your pap smear. Is you're supposed to have it yearly. Please get pap smear checked. Go get your pap smear.
Thank you, Miss Nancy McCamara. If you are watching us, happy Sunday. I want to welcome you for watching Table Talk with Rita Fele Harasi and founders of Daughters of Sierra Leone. And at this time, I have with me on the studio Mr. Samuel Omotosho. He's joining us straight from Nigeria. Samuel?
Yeah, good evening, everyone. Good evening. Good evening. Happy to be here. Although I'm late, but
okay.
nevertheless, I'm happy to be here.
Thank you. Thank you, Samuel.
I've been learning a lot of things from Nancy. She has really educated us tonight, and I really appreciate that. Thank you so much, Nancy, for those valuable information.
Thank you.
Thank you. Today is Family Matter. I have my baby brother here, Samuel Omotosho, joining from Nigeria, and I have my own baby sister, my actually baby sister, here with me, giving us knowledge about, how to take care of yourself and how to be healthy. And I've seen during the past years, a lot of people. We have lost so many people. We talked about Agbo. We've talked about survivor cases that people, like for me personally, when I got my mammogram and I found out that I have, even my sister Nancy, when she did hers as well. And so it's common among African American women for having that. So probably what we're going to do, Nancy, I have a chart on how people to check themselves. So probably we'll put it on the DOSL, Daughters of Sierra Leone platform, so people can actually go and print it themselves. How to check on for women, how to check their breasts and to make sure that nothing is going on. If you feel like a lump, which is common for most Black women, we always have lumps on our breasts, but it's always, if you feel the lump, still go to and see a doctor for them to see if they can do a biopsy to make sure they check. I believe in Nigeria they still do biopsy, but most of the time, most cases, I see they send things to South Africa. They have a lab, in another country or in Ghana. It's quite a shame that we should have those things, because a lot of our people are dying with stuff like this, and we don't have those facilities. Just basic things that we need, we don't have. Just basic things that we need to go get yourself checked. Okay, let's say they go and get checked. They're sending their thing all the way to South Africa. So this is basic things that we need to have. So Samuel, do you have any contribution to add to what everybody have said?
Yeah, thank you so much. I've been educated here. Although I have a microbiological background, I understand what it is to get yourself examined in the laboratory. Always, prevention is always better than cure. So I think what I will add to what Nancy has said earlier is that for even not only cancer, although cancer is what we are considering tonight, not only cancer, regular checkup is key. For our health. It is very important we do regular checkup. It's very important. Like Mama Rita has really said the other time, that self-examination. Now we advise for everyone watching wherever you are, it would be good that you join DOSL platform, so that the information is about to drop in the group, you can be able to access it. You can check search on your Facebook, Daughters of Sierra Leone. There is a Facebook community that Daughters of Sierra Leone has, so you can just show interest to join the group. The admin will accept you into the group, so that every information she's about to drop in the group, you can always access it. And another thing I will say conclusively is that every time we come here every week to share invaluable information, about health and every other thing that we do. Please don't just listen to those information, because everything we do here is free. It doesn't mean that it should just come for free like that. The impact is when you listen to things like this, you ensure you practice them, you put them into practice. That is where you get the result. These are invaluable informations from experts. So when we bring them here to do something like this, ensure that you make proper use of this information. That is where we can be happy that the impact is really getting to the people that really deserve it. So I will encourage you once again that you join the Daughters of Sierra Leone platform on Facebook, the Facebook community, so that the information is about to share about how you can check yourself as a woman, you can be able to access it. That's what I have to say. Thank you so much, Nancy. I've learned a lot from you from the backstage before I come in. Thank you so much. That's very invaluable information. Thank you for sharing your experience and expertise with us.
You're welcome. And also,
Thank
again, I want to talk about, and I think I did not hit on that, is also some signs and symptoms people need to be looking for, especially when it comes to the breast cancer part. Is usually we have like a tenderness. Sometimes you have like a discharge, like how some people say, oh, like they are breastfeeding and they have this little discharge from their breast, some pain, lump on your breast. Those are some signs that you need to be looking for. Those are very early signs that you need to look for. And please, if you see like a redness, or you see a mark or thing that you never see in your breast before, please go see your provider. And with your cervical area, please check for abnormal bleeding. Like if it's not regular from your menstrual cycle, go abnormal bleeding. Also check for abnormal discharges with a foul odor, things like those. Things that this is not what my body used to produce. Please go and check. Go make sure you get checked out. Or maybe if you're wiping yourself and you feel some abnormal lump or anything that was not there, that you feel like is not supposed to be there. Yeah, please go get checked. Go get checked out. Usually with those with the breast part where you see those abnormal tissue, because that happened to me in 2018, 19. I woke up. I woke up and I felt this abnormal swollen to my left breast, and it was just there was this lump, and I can feel it. You can feel like a line. I can feel it on my breast, and I get so scared. On the 18th of my birthday, September 18th that year, I went to get a mammogram. After the mammogram, first they did a biopsy. They took some tissue out, but because it was not conclusive, so the doctor sent me to go get a mammogram, which they did right there, and they just told me, hey, it's normal in African American. Sometimes that's an abnormal growth. It's just an abnormal tissue. It might go away. But this is what we want you to do. Every 6 months, we want to monitor. We want to monitor you. Make sure you come every 6 months and get monitored and get checked. They will keep doing this this biopsy. A biopsy is a thing where they take a needle. If you don't know what a biopsy is, they will take a needle and go in some part of the area, and they will aspirate a fluid, or they will cut. They will aspirate, or they will pinch. Should I say they will pinch a little tissue,
Like a little tissue out.
yeah, that
So
area.
the lab.
Yes, and they will send it to the lab. And once they send it to the lab, they will find out, is this a normal tissue or is this a cancer tissue? Because with cancer, the cell is intervening in the regular cells area, and it tries to fight the good cells. So that's what the cancer is all about. So now they will take and see, is this a cancer cell, or is this a regular cell, or is just a fatty tissue? So that's what they did with me. Well, with the cervical part is they will go inside your vagina area, and they will go and see whatever is abnormal. They will scrape, just like they will do the pap smear. Because pap smear, what they do, they get you they put you in a position like you're giving birth to a baby, like you're having a baby, and they will scrape. The doctor will go in and scrape in. Well, once it's scraped, that little fluid or whatever it is that they scrape out, that's what they will take and send to the lab to make sure it get checked out to see if it's nothing. So, but if you don't go complain, if you don't go get checked out, you will not know. And with the men part, when it comes to them, is you assuming the position and they go in and go with a scope. It's like a little needle thing. It's a thing that they will ask you, they'll make sure you drink. There is something the doctor usually give you and tell you to take that will get you to use the bathroom. You will use the bathroom so much and clear out your old intestine. It will clear you out. It's like a laxative, but it will tell you to drink the entire thing. Once you're done drinking that in the morning, you will go for this test and you will assume the position, and the doctor will go, it's a little long needle, a long thing that have a light, that have everything in there, and they will go where they're supposed to go and look and clip. If they see like a little polyp on the way in, they will clip it. Once they keep going, anything that they see down there that is not supposed to be there, on their way, it's like they're clearing the road. They are making a way. They are making their way in. And as they go, whatever they see that is abnormal, they will clip it. And once they're done, they will take that and send it to the lab as well. So, but if you don't go get checked out, you will not know. So please, my people, my family, please go and get checked out, because this is very, very important. Don't wait.
Thank you so much, Nancy. Great contribution, great point. So I'm gonna break it down a little bit, and then before we wrap it up, so I'm gonna go first with Creole. For my salon people, for una way they watch me. Una don't hear all waiting. We don't talk. We get people that we don't talk. We get Nancy. We don't see you. Samuel self don't see you. And Dr. Daniel too. Where they try for joining from Nigeria. Don't talk you. So everything it depends on you and what you want for do, all man can talking on. Like for we the woman them, I know say what you will like for do. We just want no more only the thing where they can don yanda usai for check you na your vagina na only man property no more na for go inside it. But not to only that no more. When they do that business day, once in a while, if now once every 6 months, go to gynecologist, they made them check and see what's in the happen with you down day. And I know say sometimes some smell like can come out down day, we not a normal smell, but we they feel say no more. Okay, but we go come back again on that smell part. They know so Nancy will come again and talk about that. So a lot of stuff you go they discharge a lot, but because of you they discharge, you feel say it's normal. For lay you they get that kind smell, the odor way they come out down day. Most of them tend they na infection, but because of you're not able for no say na infection you get, you just feel say it's normal. The perfume where they come out down day, it's a normal perfume, but it's not normal at all. But we'll come up again with another subject on that where we'll be able to talk about it. And man them, una self, not for just sit down no more. You sit down, you eat cassava leaf, potato leaf, pemau, all them kind of thing. They drink you beer, you feel say it's all okay. No, go check yourself for see where they go on with your health. Go and get checked, because if you not go get checked, then say, well, body now wealth, now gently. But when you not get money, you they say I want to be rich. Then if you are rich, you don't have the health, then it's a problem. So please, for my Niger people, then say, who will get health? If you get health, health is wealth for my Nigeria people. If you know say as a woman, not be only that man private partner for go inside where you're supposed to go inside. No. Go get checked. Pap smear is very, very important. If you go hospital, you go check. Even if you're not able for afford and say, okay, that money where you go take go buy bone straight here, make you use them to invest on that thing down there. Make you go check yourself to make sure say you dey okay. Because if you die tomorrow, that bone straight here where you get, now your sister go wear them. Now your cousin go inherit them. So if you go buy bone straight here, you not get good health. It not make sense at all. Make you self thinker. Money where they say I not get money, Nigeria is hard. Hey, see not even they self to chop. You go cut down on your expenses. If you know say na health you want focus on, make you focus on your health. If you know say na bone straight on material things where you not need, you not care about health, make yourself you check them out. It not go well. e no go well at all. For all the men dem wey una feel say man dem una no dey get breast cancer, men sef dey get breast cancer, because I don get uncle of mine wey survive breast cancer. Man dey get breast cancer. Any kind of cancer wey you think of say e go happen, e go dey. Nobody dey wish say make sickness come, but if sickness don come, make we know how we go take manage that situation. So Samuel, I go make you give your final goodbye. Make you add your own small thing inside to our viewers.
Yeah, thank you so much. And what I will say conclusively is that I want to paraphrase what Mama Rita said. You know, in the course of looking for money, we neglect our health. And one thing is very basic. When we get the money, health should not be a problem. I pray. But you know, the way we use our body today, the way we care for our body, the way we care for our health, it's very important. My pastor said something one day. He said, we pray that we get money, we get wealth, but we also pray that when we eventually get the money and we are wealthy, our health will not now be our prayer point. Do you understand? Then, in order not to make that happen, fine, we pray to God for sound health. At the same time, what I believe is that God will not do what man should do. All right? Why man should not expect God to do what he can do. All right? Prevention is key. Self-examination, like Nancy has said, is very important. All right? Regular checkup. God is not the one that will do the regular checkup for you. Do all of these. Ensure that you check yourself every time. Then now trust God for divine prevention. And if eventually happen, you can now say, okay, let's follow doctor's prescription and also still trust God that the drugs will work fine. All right. Don't over spiritualize what you are not supposed to over spiritualize. Let's be wise. Let's live long. It is when we are alive we can also and make money.
Of course. Sam, you know why I'm laughing? Dr. Jerry Eze, he's having a conference, I believe, next week in America, here in Houston, and he said that a lot of people will just go, like they will just come to America, not come to America where you know say you not get visa, you don't know how you want to come, make you not come. So it goes back to what you were just saying, that our spiritual fathers, and our mothers, they teach us to believe in the word. They teach us what they know. But like, you cannot say, I've seen so many people, they say, I'm a Christian. It's against my religion for me to take Panadol or to take my medication. I'm in faith. No, they didn't say that. Even our spiritual fathers, they go through their own health challenges, but they do take their medication. Even if you see when they are fasting, they will announce, say that if you are fasting, if you know your health, or if you are nursing mother, or you are pregnant, not to be part of it. Meaning to tell you that they understand that what you are going through at that time. It doesn't mean they are telling you not to take. That is another separate topic for another day. But all what we have said here today, I hope that people learn from it. And if you know that you have, like I have a very close sister to mine, pretty much her dad died of cancer, her auntie died of cancer, her cousin died of cancer, and she's in her 40s. So now, before, normally it's when you're 50 in America that they get to check you for a certain type of cancer. I forgot what kind of cancer that is, but because cancer, so many people that are dying in her family, they've been dead of cancer. So now they are watching her. So they have to make sure by the time she's 45, they're checking her. She has to go run that test. So the other day she called me. She was like, "Oh, I'm scared." I said, "You will not be scared. You know, you are going to go do that test. If it costs me that I have to fly all the way to meet you where you are, because we are totally in two different cities, I will be there to make sure that, you know, you get it done." Because I myself, I worried a little bit, because each and every one of our family that have been passed away, they've been passed away of cancer. So it's a concern right there. So even herself, when she sleeps, she thinks about it. When I'm like, oh no, don't worry about it. So if you know, like for my family, I know we have high blood pressure. My dad has high blood pressure. So that's my family history. So when I go to the hospital and someone say, did anybody have high blood pressure in your family? I said, my dad. So I watch what I eat. I watch certain things that I do because I already knew that my dad has that. So it can pass me, but the next generation, probably one of them might have it, right? So we're very careful with how we deal with certain situation. It's good to know your family medical history. It's very, very important. Somebody, were you saying something?
Yes, I was just complimenting what you said. Family history is very key.
Very.
You know, it's one of those things that we need to always ask questions, try to know how your parents are living, try to know their health challenges, that you can also, and like you said, please, sometimes, you know, there are some things that we're not supposed to be eating actually. Okay, let me say, even if you will eat them, it should not be often. You should not turn them to your daily meal. You know, in this,
you know
exactly,
this thing when they say that red oil, palm oil, you should not eat it. Abi Nancy, when they cook like some serious soup, like they feel like, okay, the palm oil should be in the level, it has to be on top, you know, but more shaggy, everything, like people just want to eat it. Like you can eat it, but just small portion. Love to have portion control. You know, I remember when we were in Sierra Leone, you will see I will eat some certain things, but I will eat it in small portion because I always have this in my mind that family history, you know. So I don't go above. I don't eat as much as I love the food, but the food will still be there if I'm not there, right? So you have to be mindful, have to be conscious, always remember that, okay, my family, the history. You know what I mean? Because if my dad is on medication, try to stabilize or try to take medication to lower his high blood pressure, or if you're having a cholesterol issue, and if you're having all type of issues like that, so you are be like, okay, you know what? I have to watch what I eat and the amount that I eat. You can control that, right? You can control that. But some people want to eat begidi. You want to eat this one. You want to eat pemao. You want to eat ngari and this one. You can eat them, but in small portion. You have to have portion control. Portion control. Don't eat the whole big pot because you see the pot. Hey, today I'm here. You will go die for a year. No, don't do that to yourself. It's not healthy at all. Nancy, you say what?
It's not healthy. It's very dangerous.
It's not healthy. You know, like we see when they cook, right? If there's this thing we call pemau or like dry rice, you know, you eat it and stuff. Some people who have the palm oil, red oil, it will be dripping. This is a lot of cholesterol.
And that cholesterol, what people don't understand, those red oil, coconut oil, all those oil go in your arteries and clog them up, and you end up with atherosclerosis, which is in turn end up with getting your heart attack. Because the most important thing, one of the most dangerous thing that causes heart attack is atherosclerosis, which it go and clogged up all your arteries, and the blood cannot even flow. So now you have this plaque that is building up there, then you see it dislodge, then they say, oh, you have an aneurysm. Hello?
Yeah. But, you know, a lot of things again, Nancy, that people, we always say, hey, these Oyibo people, they don't know anything. These white people, they don't allow you to food. They want you to eat it, but they want you to eat it. Be moderate about it. Be cautious about it. Don't cook the red oil. If you have 5 gallons of red oil, you say you want to cook 2 pots of soup, you pour everything inside. No, you can cook the palm oil, Sam, but just put a little bit. Let it just be on top.
I think they don't understand the basic understanding where they say you have to understand how the body system works, and you understand whatever you eat, whatever you put in affects you in a way. I think that's our problem. We want to eat it to the point where you can't even breathe. You're sitting there, you just ate red oil, but not knowing it's going to mess up your arteries. And you're sitting there thinking, okay, I'm eating. this is our natural food. Everything everything that you eat too much is not good for you.
No, it's not.
Yeah.
You
Yeah.
can it's not good for you.
You know, I
Yeah,
remember
that's true.
after coming overseas for so long, and like after living out here for so long, right? And I have this bad, and when you go back home, you're very conscious of what you're eating, and you're conscious of what you're drinking, the water, and like your environment. You're very, very careful, because let's say after 5 years you've lived the shores of Nigeria, or 3 years self, right? You go back, you are not the same person. Okay, let's just make this clear, because one, your immune system, everything about you have changed, right? And so when you go back home, things that you used to do or things that you used to eat, when you eat them, it's not the same anymore. You get what I'm saying, Sam, right? And so people
Yeah.
tell you that, why are you acting so fake? And this is a food that you
It's
used
not.
to eat. It is
Just
not the
just
same
understanding
anymore.
yourself.
Yeah,
Yeah.
it's not the same. And I used to have that when I went back home. And so certain things that I used to do, or certain things that I used to eat, but my body doesn't, I'm not able to eat them as much as I used to eat them. You get what I mean? So people think
Yeah.
that, oh, why is she acting so fake? She grew up here in Africa and she used to drink this water. Why is she drinking bottled water? But they don't understand that my system has been adjusted to where I am living. So you notice, even if you come from Africa and you come to, let's say, to the States or anywhere in the world, your body has to adjust to where you are living.
Definitely.
So then people don't get,
Definitely.
so for people that says that when people go back home and they are being mindful of what they eat, yeah, we've used to eat that. But now our system is being changed, right? So there is a thing for change. So if Nancy is not here, she can be able to give the knowledge that she knows, right? As a nurse, right? So Samuel will not be here to give his own knowledge, right, Samuel? I will not be here to give my own knowledge. So this is why Africa, it's a very, very good place for us, because some of us, we are in different part of the world. You guys are there, and then we are all coming together, putting our ideas, talking about it, so we can find solution.
Yeah.
We all about finding a solution. But if we don't talk
Of course.
about it, it's not when somebody come up and say something, why is she being fake? Why is she not being real? I'm being real, but it's just that, hey, my body's not the same anymore, and I can't eat what I used to eat anymore. I can eat it, but
Of
in a
course.
smaller portion. Or I can drink, I
course.
cannot go to Sierra Leone and say I want to drink tap water. Hell no. You know, I can't go to Sierra Leone and say I won't take my malaria prescription, because I'm not used to it anymore. You know, for America, they can't treat malaria. They treat malaria as if it's HIV, a world deadly disease.
So what? HIV is even better.
Okay, thank you. They isolate you, right?
I would rather treat an HIV patient than I treat a malaria.
Thank you.
I'm sorry.
Thank you. But they're scared of it. They are scared of it. If you tell an American that I have malaria, tell your doctor, if you're in America or anywhere, say I have malaria, especially America, they would think like you are dead. They already convict you already. You are dead already for them.
And malaria is normal thing here.
But that's what I'm saying. It's not a normal thing. We don't have mosquitoes that will bite you.
An HIV or the worst patient that is about to die right now. I would rather be your nurse, and I'll be glad to be your nurse. Because malaria, you have to understand, is a transfer of disease. Something beat somebody and came here and bite you. I don't know what that tick or that mosquito have. I don't know what he transferred to America. When they say, if you know what good for you,
if you go to the hospital and say I have malaria, everybody will get good from you.
Don't ever go to the hospital and tell a doctor, or an emergency room and tell a doctor, I have malaria. They will ask you, you said what? You said I have malaria. Immediately, they are going to suit up. Like how
like COVID time when they mask and everything.
Ebola. Because
Ebola.
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 Just
Oh
like
my
Ebola,
God.
My brother, let me take care of me myself. Let me take care of HIV instead of malaria. It's just simple.
You see how serious it is? And then, but in Africa,
Oh my God.
in Africa, that's our normal day to thing.
Should I shock you? Should I shock you? Should I shock you?
Go ahead.
Even in Nigeria, I'm a microbiologist, right? In Nigeria, it's rare that you will take a blood sample of anyone and run a blood test. You will surely find plasmodium in the blood. Like it's normal. Like in fact, some people already know what they take to treat their malaria. So when you say, in fact, if you tell your boss, sometimes in the office, they say maybe you work somewhere and you say, boss, I'm not coming to work. You have my ordinary malaria. ordinary malaria, you know, because like everybody knows that, okay, when you get your artemether and lumefantrine, you combine, you synergize them together with paracetamol, you know, if you are not fine, then go to the office. You understand? It's like a normal disease.
Yeah, but here, no.
Not for us.
Because mosquito is everywhere.
No, but here, no.
No, it don't matter, but the one that causes, the one that mosquito is everywhere. But it's the one that causes that malaria. That
let me say, okay, let me correct myself. Mosquito is not everywhere, but you can control mosquito from getting to where you are. Let me put it that way.
Exactly.
You can control mosquito from getting to where you are.
Exactly.
Do you understand? So it now depends on where you live, the mechanism you've put in place. Even with that, an average Nigerian will have plasmodium.
Even in American hospital, if you are an African, you get sick. I swear, the first thing they will ever ask you if you go to a doctor's office, do you travel out of the country? What country? Were you bitten? They ask you, do you travel? When do you travel? Have you traveled for the past 6 months? The moment you say, oh, I went to Africa, I eat and
red flag.
Red flag, they put you in a private room just because you say you came from Africa.
Wow.
You know, it's so true because when my husband come back from Nigeria and he has malaria, you know, and he has malaria, he come back, malaria up and everything. And so what I did was, I have so many nurses in the family, you know, everybody, and I was like, okay, I already know what to do. So, but what he normally does is when he's in Nigeria, he always have all those malaria medication that he takes, right?
Yeah.
So when he got home, the first thing I do, I check him if he has COVID because we have kids. So if he didn't have COVID, I already know he's on malaria thing, you know. So we start giving him the dose immediately. So he start taking all these medication, you know.
You treated him like a Nigerian, right?
I'm moving to the other place, like because I already know how that thing is, you know. So I'm already moving. You know, like I'm like, hey, malaria.
This is really funny to me, honestly.
No, it is. So if you've lived here for so long, right? So like all these things, malaria. I remember when we just got here, and I was telling my dad that I have malaria. My dad said, malaria? Please don't say that to anyone. You remember Nancy, right? I was like, my dad said, please don't even mention. I told my dad, like, oh, daddy, I want to go see the doctor. I have malaria. Because for us, it's a common disease that we go through every day. We deal with it, like moving from Sierra Leone and coming here in the States. So I'm telling my dad, like, oh, I have malaria. My dad was like, you don't have malaria. You know, he said he's like this. His voice was actually strong. You don't have malaria.
My dad had his voice and it was
yeah, I said, you don't have malaria. I said, I do have malaria. He said, I said, you don't have malaria. I said, okay. So I kind of like got it.
Oh my God.
I kind of got it. You know? It's a very, and he explained to me, you don't want to go in around telling people you have malaria. Here you can't say that.
You
cannot say that.
It's dangerous. If you go to a hospital let's say
If you say that, if you're in somewhere, people start shifting on you. If
They
people,
shift
if you
away
say you have
Really?
HIV, people are even okay.
Really?
Hey,
Really?
yeah.
the moment you have malaria, it isolates you.
Yeah.
My dad, first and foremost, there is two things you don't like. You know, the African food, the way they prepare the oil and all of that stuff.
Look like that. When he goes to Africa, when they are doing their like things, like you will just be looking like. You remember I used to look like that, Samuel, right? I'll be looking like, wow, everything is strange to me. I'm like, wow, you know, this is nice, you know.
My dad,
But
if you
like,
even my dad, if you see you eat African food like a lot of oil, the first thing that come out of his mouth like cha 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 cha.
you know,
And that's why program like this is very good for us to educate our people, because one thing I've come to realize is that for
Samuel,
an
sorry,
average,
have you seen my dad? Have you seen my dad? Like, have you seen his
no,
picture, right? No, you haven't seen him in person, but you've seen his picture, right?
yeah, I think once
Okay.
that
My
time
dad is
that you traveled
70,
for a vacation like that.
right. My dad is in his 70s, right? He looks like he's
in
his 50s, right? He looks great,
Wow,
very physic, you know,
wow,
like he's
wow.
very works out. He
That's
watch
great.
what
That's
he
great.
eats. You cannot tell my dad is in his 70s if you see him.
If you see my dad,
Wow, that's
I don't eat this. My dad only eats baked chicken. Everything
Baked
else
chicken, he eats his salad. If he eats
salad.
rice, he eats small portions.
Half spoon, not even one. Half.
Yeah, he just eats a little portion. He just want to have that.
honestly, it's fantastic to hear all of these. You know, in Africa, we believe an average African man, we think, okay, when you start making money, you want to enjoy life, right? And if you ask him, what do you want to do to enjoy life? And you begin to hear, eat pepper soup, eat and burger, eat meat pie, and you begin to see all these junks.
Okay, now let me tell you
All
something.
these junks.
Okay, now let me tell you something. Samuel, I don't like big chicken.
Yep.
I don't like chicken. I don't like beef. I don't like pork. I went to Africa. I said, Nancy, I said, I don't want that chicken. I don't like chicken. I don't like beef. I don't like pork. I will eat them so here and there if they barbecue and stuff like that. Even if I'm cooking African food like potato leaves or cassava leaf, I just want to taste that dry fish. And it's not a lot. Do you understand? I don't like meat. Don't give me meat. Don't give me. I don't like none of them. It's not because I'm crazy. Because I know sometimes you just, even in America, you're just tired of eating it. Then alone, it's not even helping your health. You understand?
I have with me a surprise. My daddy's here.
Oh, that's my dad.
Oh.
How you guys doing?
Hi, Papa.
Fine, sir.
My dad is here.
Good evening, sir.
You know, see how great he looks. My dad is here with me.
Good to see you. Good to see you, sir.
Thank you.
That's what we're talking about, Samuel.
Bye-bye.
What is it, Nancy?
Dad, right? Isn't he handsome?
Yes.
Okay.
Looking great.
So
That's
this
guy was talking about. I don't eat a lot of African food. That do cha 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 cha.
No,
cha.
it's good to eat our African food because that's what we grew up with. But he eats it, but he eats in a very smaller portion. It minimizes. He doesn't just eat it like, okay, I'm eating a wedu now. I have to eat the old pots. No, I'm eating a begidi. Abi, am I saying it right? You're eating the whole thing. No,
Yes.
you can't. You know, you eating obiata. You want to eat the whole thing? No, you cannot. You know, eat small portions. We are not saying don't eat our food. We eat our food. I eat cassava leaf, potato leaf, okra, tola. I dey eat all of them, but I know they eat and like, say, wow, eat and now. I want sit down now, I want press, I don't want grab again. All the body na no.
If you want to eat all the African food from Nigerian food now, Ogusi, Esewu, all those fine, you come to meet a house. That's where you will eat it. Me, like, if you come to my house, you will starve. I will give you.
Okay. You know, sometimes it's so crazy, right? I cook all those food, but me and my husband, we are not big eaters. We eat small portions. We are not eaters, right? We're not eaters. And so sometimes people see my husband like, all the food where you, like your wife cooks, like, where is the food? Like, my husband doesn't really eat like that. If he can only go ahead, Nancy.
Rita house is full with all the delicious food, but they don't eat that much. You have visitors that basically eat the food. Rita is a big cooker. She loves to cook. She loves to make sure people are welcome. Me, on the other hand, don't come because
she's the mean one. She's the mean one in the house. She's like, stay in your house. She just tell you direct, like, okay, you can't come and visit. Bye. You know, she's that one.
Who eats?
Yeah, you know, like the second child in the family, right? Because she's after me, right? So the second person, she's very like, she just give it to you blunt, right? So like me, I'm the first. So I'm just like,
I don't like you. I'll tell you just like that. I don't like you. Simple.
Yeah, she'll just tell you like that, you know? So I'm like, that's me. You know? So then we have our other sister. We have Augusta. She's more like me. We are very soft spoken. We are calm. We're very sensitive.
Soft spoken? Augusta is not so.
Well, like not like she's she's soft spoken, but when she wants to give it to you, she gives it to you direct, you know. And then like she's like that, you know. But like me, when you step on my toes so much, and then for me to really get upset, you've seen me get in action. So like for me to really get raised, you really have to do. So even when you tell her like, oh, so if somebody did something to me, I'll just call her. So she's the firecracker in the family. She'll not call you straight up. She'll not call you.
Call me, then I'll pick up the phone. I'll call you nicely first. I say, hey, what happened?
What did you do to my sister? You know? She'll not give it to you. If you want to start catching her, she'll just load you. She'll just give you double dose, Panadol, paracetamol, every one of them. She'll just give you.
Oh my God! This is amazing.
So anytime I was just like, no, it's okay. It's not okay. I need to call that person. You know, she'll not call the person.
It's not okay. If it's okay, it's okay. But if it's not okay, you gotta let the person know it's not okay. What you just did, it was not right. So you have to put them right there and make sure they understand the situation.
Right. Well,
learned a lot.
I want to thank you so much for having me today. I really appreciate. I have to run. I have to go see a patient.
Okay. Well, I think.
All right. Thank you, Nancy. Yeah, good to see you today.
Now, just one more. Let me just do a final close and So we've been watching Table Talk with Rita Felehera. I just want to use this opportunity to thank each and every one of you that have logged in, and for those of you that we were watching later, I just want to thank you guys. And Doctor, I want to thank you. You've been trying so hard, Dr. Daniel, for joining us all the way from Nigeria. I just want to thank you. Lady Vera Okumbajo, you've been trying so hard to be part of this broadcast. I just want to thank you as well. And I want to thank PROIB Blog, and I want to thank Bantu Blog and Daughters of Sierra Leone, and myself, Rita Felehera, and for my beautiful and amazing guests here that I have with me, Mr. Samuel Omotosho. I will have you say your final bye, and where can our viewers reach you? Thank you.
Yeah, thank you so much. I'm Samuel Omotosho, like I said earlier. So make sure you join DOSL platform on Facebook. My Instagram ID is Sam_Omotosho. Omotosho is OMOTOSHO. Sam_Omotosho. My LinkedIn also is Samuel Omotosho. Then my YouTube channel is Skill and Value Hub, SVH. So you can reach me there. I have valuable content that you can benefit from. Thank you so much. See you some other time. Thank you so much, Nancy. Thank you, Marita, for this opportunity. I really, really enjoyed the show tonight.
Thank you, Samuel. Thank you. And Nancy, I will have you to give your final bye, and where can our viewers reach you as well?
First and foremost, I want to say thank you so much for having me. I want to say thank you to the CEO and founder of the Daughter of Sierra Leone for having me on your broadcast today. And I want to thank this fine young man here for being on board today. I appreciate you. I learned a lot from you beautiful people today. You can follow me at Nas Kamara on Facebook, or you can email me theophiliakamara@yahoo.com, or you can also email me at the Golden Art Foundation SL. You can just reach me out. Thank you so much for having me. It's a pleasure being here. It's great to learn new things, and I learned a lot from you beautiful people. So till next time, thank you so much for having me.
Thank you, Nancy. And I want to give a shout out to one of my team member, Minister Joe, for getting married, finally tied a knot. It was a hard thing to do, but we want to give him, the DOSL family, we want to say congratulations to you and your wife, and may you enjoy all what we've been enjoying and enjoy more. We will love to welcome you, because in DOSL family, I think he was the only one, right, Samuel, that was not married. So we want to welcome you into the marriage.
Oh yeah.
And something, aren't you excited to have, like Minister Joe? Finally, I'm excited. I don't know about Samuel. What do you think?
I'm excited too.
That laugh has something. I'll call you about that laugh. But I just want to thank all of my viewers, and I want to thank PROIB Blog, Bantu Blog, for always giving your platform for us to use, Daughters of Sierra Leone, and myself, and for all my viewers, for all of you guys that are taking your time to be part of this conversation. I can do this without you. We can do this without you. So God will continue to bless each and every one of you. And if you're celebrating your birthdays, anniversary, anything that you're thanking God for, I also want to thank God with you, and I want to celebrate with you. Till we meet again, Table Talk, let's talk. If you have any topic you want us to discuss, please feel free to send your message to PROIB Blog, Bantu Blog, Daughters of Sierra Leone platform. And thank you. Till we meet again, we're about to draw the curtain, and we say bye bye.
Bye.
Yee.